Hi there, my name is Alex. I'm a social worker and my work is to help people reach their health balance as well as get closer to their wellness. However, people like us find it difficult to have our own balance. So take a moment and think about how you define wellness and the components of wellness. Wellness is balance in physical, mental, and spiritual aspects. So the components of wellness include everything that contributes to a healthy body, such as nutrition, balancing, and physical activity. Beyond physical health, mental aspect is the upstream factor of well-being with the presence of joy and fulfillment in both personal life and workplace. So, how do you define wellness? Wellness can be different for every single person. For example, if a person has a poor life, wellness with them sometimes is just having a place to live or plenty of food. In our project, we heard from the community service workers that wellness is holistic, but many of them cannot feel it at work when they spend most of their time there. So now we're going to go into a community center to show you how busy it is and how the healthcare workers are always there for their patients, helping them out in any situation. As a social worker, I feel burnout with great enormous workload. Every day I meet many people with different problems and they are in pain. So how can I help them effectively if my well-being is not okay? Understanding the challenges of health and social workers, especially during the COVID-19 pandemic, has showed us that our healthcare system is not as strong as we thought. So we're teaming up with the project of Bridge for Health at the intersections of services, provider, well-being, and equity in healthcare and social. So the overall purpose of this project is identifying how healthcare providers can be more aware of their wellness, how to address burnout and stress in the workplace, as well as proposing a new way to improve the joy and fulfillment experienced at these workplaces. Our participants are including, but not limited to, any race, religion, gender, or their roles in the healthcare setting. We build a great conversation with multiple focus groups of direct healthcare providers and social workers. So this project started during the COVID-19 pandemic, since we all witnessed the burden on healthcare providers and how desperately they were needed to protect everyone. So among 76 voluntary participants, about 82% of them responded that they experienced stress and burnout at work. However, although wellness promotion services are suggested in workplaces, participants are either not fully aware of them or the services are not easily accessible, and they wish to have more action to practice well-being and wellness improvement exercises at work. In addition, we found that the top 3 factors that make our participants feel joy and fulfillment at work are flexibility, respect, and social contribution. Healthcare workers who responded to our survey are diverse in race and gender. They identified as white, indigenous, Asian, or immigrants, as well as binary and non-binary. Racialization or gender stereotypes seems to be a problem in the health and social services workplace, leading to inequities occurring in different ways. Participants reported that the role of privileges in workplaces affected their emotional wellness, and so do the patient's experience. When we asked our participants about what their organization's capacity to address racism and other forms of prejudice and discrimination was, this was one of many responses we received. Even though many of the staff on the team are very knowledgeable, aware, and want to push for organizational structures and systems to support this, to date, there has not been any specific action taken to addressing racism and discrimination in the workplace. For example, our team has requested for paid time to set up educational opportunities and internal community of practice to talk about her own internal biases and racism. I believe that there's just too much happening and that it's not possible to further request people to do something without increasing people's capacity. Some other quotes from participants consisted of better service delivery and workplace culture that encourages wellness. We all really appreciate the contribution of health and social workers to maintain the proper services to communities, especially after the very hard times of the COVID-19 pandemic. We want to propose a call for action of healthcare facilities to develop wellness interventions and support health equity in workplaces for their social workers. For the health and social service providers who are experiencing burnout and stress at work, we want to promote a way of reaching wellness by taking a moment to think of the factors that make you feel joy and fulfillment every day you come to work.